CNN is not responsible for nosophobia or any other irrational fears of catching diseases. Viewer discretion is advised. Thanks for joining us on CNN, the Contagious News Network, where we discuss a new disease every week and the symptoms to be aware of in your everyday life. Tonight's disease is Whipple disease, a rare bacterial infection that affects the gastrointestinal system and the body's ability to absorb nutrients. Whipple disease can be very serious and in some cases can be fatal. However, a course of antibiotics can treat Whipple disease, and in most cases there's nothing to be worried about. The cause of Whipple disease is an infection within the small intestine and the villi, which absorb nutrients. The cause of Whipple disease is an infection with the bacterium Trophariuma whippleae. This bacteria initially affects the lining of the small intestine, damaging the intestinal wall and fine hair-like projections known as the villi. Although the infection is rare and only affects about 1 in every 1,000,000 people, associated deaths continue to be reported due to late diagnosis and delayed treatment. Death is often caused by the spread of the infection to the central nervous system, caused by irreversible damage. Over to you, Phil. Thanks, Tom. I would also like to point out that the disease does not only affect the gastrointestinal tract, but in some cases can spread to the joints, the central nervous system, and the cardiovascular system. With me today, I have a patient who currently has Whipple disease and is here to tell us about his symptoms. Thanks for being here, Bob. I would like to start out by asking what you experienced when you first contracted the Whipple disease.
Well, I experienced a wide variety of signs and symptoms, including diarrhea, abdominal cramping, and pain, which worsened after meals. I experienced weight loss because I couldn't absorb nutrients.
Very interesting, very interesting.
And extremely inflamed joints at the ankles.
Ankles, yes.
Knees and wrists.
Knees and wrists too, okay.
I had a cough. Sorry. And experienced chest pains, and sometimes even had difficulty walking.
Well, sir, those sound like some extreme symptoms. I would like to ask, when did you contract Whipple disease?
Well, my doctor said my symptoms developed slowly over a period of many years.
Okay.
And my symptoms such as joint pain and weight loss developed years before.
Before you led to diagnosis?
Yes, sir.
Okay, well, thank you for your time, Bob. I really appreciate it. Really appreciate it. Over to you, Phil. Back at the studio. Thanks, Bob. According to available reports, Whipple disease is more likely to affect Caucasian males between the ages of 40 and 60 who live in North America or Europe and have frequent contact with the outdoors, specifically with sewage and wastewater. Since so little is known about the bacterium, risk factors have not been clearly identified, and in some cases, the carrier of the bacterium might not even have the disease. Whipple disease is potentially life-threatening, yet usually treatable. Contact your doctor if you experience unusual signs or symptoms, such as unexpected weight loss or joint pain. Your doctor can perform tests to determine the cause of your symptoms. Here with us today is Dr. Hickman, who is going to explain the technologies used to diagnose Whipple disease and the treatment options after diagnosis. Over to you. Thank you, guys. Today I'm going to be talking about Whipple disease and what sort of medical procedures are going to be required to help cure the disease and what sort of technologies are used to diagnose the disease. So first off, your doctor is going to begin by doing a physical examination of you. They're going to check for your abdominal tenderness, and they're going to check of the skin darkening all over your body. Then they will likely take a biopsy by taking tissue from your small intestine. So what they do is they take a small little scope and they put it through your mouth, through your throat, esophagus, and through the stomach into your small intestine. And what the scope allows your doctor to do is basically see all the muscles and the linings of your intestines and muscles and the organs, and then they can take biopsies if they need it to. Then the biopsies are microscopically examined for the presence of disease-causing bacteria and the presence of gram-positive stained bacteria. The doctor may also order a blood test to check for low blood cell count and low concentrations of albumin, which is a protein in the blood. And if you're diagnosed, the treatment takes between 1 to 2 years. And so basically what happens is your doctor might prescribe you with more than one antibiotic because your body might become immune to one antibiotic because it's such a lengthy procedure, right? And it depends on what stage you are too, because in the final stages where the bacteria affects your nervous system, it can become very dangerous. So special antibiotics are required in order to help with clearing them from your entire system. Okay? Basically, if you catch the disease within a year and you do the treatment and everything, then 70% of people recover and they become healthy again. However, if you don't catch the disease within a year and you go with incorrect diagnosis from doctors all over the world, then there is close to 100% chance that you will die. Not 100, but really close. There's like almost no one who survives this disease after being misdiagnosed for a year, because the disease affects your nervous system and then it's really hard to recover after that. Okay, so I'd like to thank the CNN News Channel for having me on their station. I love to talk about diseases and inform the public. Thank you and good night. Thank you, Dr. Hickman, for your time. We really appreciate it here on CNN. Before we close the episode, I'd like to take a minute to talk about the history of Whipple disease and how it came about. It was discovered by two guys named Alchin and Hebb, were the first cases of Whipple disease in 1895. Without realizing it, they discovered this disease and they had no idea it was a special disease. George Whipple in 1907 recognized the first case of disease that now bears his name. His patient was a 36-year-old doctor who had gradual weight loss and indefinite abdominal pain and abdominal signs. He died 5 years later, and George Whipple then took an autopsy of his body and found rod-like bacteria in his intestine, which he didn't believe to be the cause of the disease. Years later, in 1961, is where the correlation between the first and second case was determined, and ever since, similar cases have been popping up all over the world in all different countries all around the world. Although only about 1,000 cases have ever been reported, it is still studied by scientists and people all over the world to this day. Thank you for watching CNN, and good night.
Smart Sound.